My first question is, can tests come back negative after that 21-day watch period or observation period and then show up positive later?
That has been a controversial issue, and indeed it can. If a test is done relatively early in the infection process, there is a high possibility that it can return a false negative. This is why the CDC guidelines are very strict regarding do not rush the tests, meaning do not test too early. The early tests or screening tests usually focus on the presence of antibodies, which means they must be produced before they can be identified.
Okay. Second one, vaccines. What's out there right now? You mentioned that there are some vaccines, but they're in very, very early stages.
Well, there's a lot of research activity in terms of vaccines and treatments, primarily focused on vaccines. A vaccine would be used to prevent infection versus a treatment, meaning which will be used post-exposure or post-infection. There are two prime vaccine candidates right now, and they're both in the phase 1 clinical trials. And during this phase, they're looking ideally for immune response. Is this drug doing what it's supposed to do? They're also looking for adverse reactions, dosaging, and so forth. And if that phase is successful, then it will move to the second phase, called a phase 2 trial. And during that time, it will be administered to those who are most at risk, mostly healthcare workers and caregivers at home.
And as you mentioned off camera, there are 4 phases. So this could take how long, possibly?
Clinical trials are usually protracted and fraught with uncertainties. They can go on for 4 or 5 years. In this instance, they're hoping to fast-track this process. Now, there are usually four phases in the process, of phase 1, phase 2, phase 3, and phase 4. But given the dire situation we are in, this will be fast-tracked. And hopefully, we wouldn't compromise on safety, because safety is one of the factors I should have mentioned that's most looked at in a phase 1 trial. So in phase 1, which I just referred to, they will be looking for safety. And so you don't want to rush that process. You want as much information as you can so that when this is administered in a more wide scale, at a more wide scale level, it is not going to have negative consequences.
At earliest, when could we see something like a vaccine coming out?
Well, the manufacturers themselves have said a year from September, late September, when this all began. So we're looking at a duration of at least 1 year.
Which, as you mentioned, may not be helpful in this dire
right.
state.
And I would say that I feel that it will prove not helpful to have a meaningful impact on the current epidemic. Nonetheless, we need to go after a vaccine.
Great. How long, we mentioned that we can get this virus with contact with bodily fluids. How long can Ebola live inside of those bodily fluids outside of the body, let's say?
Well, it's in theory several hours, but it has to be an ideal environment. For example, the Ebola virus likes moist to damp environments. But it can live, and the body fluids that are most infectious are vomit, stool or fecal matter, and blood. But yes, it can, in theory, it can live outside of the body on surfaces for several hours. But it must be an ideal environment. As I said, moist, damp environments are most favorable for such viruses.
There's 2 things that we do have going for us when it comes to this outbreak. The first being that it's very difficult to catch this disease, and the second being that you said it was a delicate disease. Can you explain both of those factors?
Yes, Ebola is frightening. It's deadly, but it's hard to catch. And it's, as I said, it's a delicate virus, meaning it's easy to kill. Basic Clorox, bleach, in the concentration of 1 part to 10 water can kill this. kill the virus. Also, hand wipes, hand sanitizers with 70% alcohol content can do so. Ebola, as I said, is deadly but hard to catch. It's severe. It's hard to catch because you need to come in contact with body fluids and secretions from an infected person. And those fluids need to get into a viable portal of entry, such as your mouth, your eyes, your nose, or a wound on your body. Now, it's unlikely that we walk around and those things happen to us. So the risk of one coming in contact with someone and coming in contact with someone who is Ebola positive and someone whose body fluids get onto them is extremely low to zero.
Now, we also talked about, does the virus stay in your system? There has been a few people who have been deemed, especially in the U.S., Ebola-free. Does the virus then stay within their system, or once you're cleared, you are good to go?
Once you're cured, the virus is not in your system. What you now have are antibodies to the virus. The reason why we are talking about convalescent therapy, whereby we are using blood from recovered patients to a sort of what we call passive immunity. Somebody else's body has developed the antibodies, and now we are introducing them into someone else who is infected and who has a compatible blood type.
Okay. And that's the next thing I wanted to get into. For example, Nina Pham, who was a nurse who became infected after treating Thomas Eric Duncan, received bone plasma or bone marrow? Blood plasma. Blood plasma from Dr. Brantley, who was cured of that. Can you explain how that was a form of treatment?
Right. And that's what I talked about earlier, referred to earlier. That's called convalescent therapy, or the serum therapy that we have heard a lot about in the media. And it is the serum contains the antibodies to the virus, meaning the body's antibodies that can combat, or the cells that can combat the virus. Dr. Brantley had the virus, his body responded to it, he was cured, and now he has those cells there, and they have a memory for that virus. It's even been said maybe that virus and other strains of the same virus. Now that is taken and given to someone else who has a compatible blood type. So you're taking antibodies, giving them to someone so their body doesn't have to go producing them. Hence we call it passive immunity. Their body doesn't have to work to produce it. And now it's plausible to believe that it will combat the virus. Now, do we know for sure it does? No, because in all instances where convalescent therapy or serum therapy was used, there were other factors also which could confound the outcome. So it's difficult to discern the specific contribution. However, if you look carefully at the cases, in almost all instances where convalescent therapy was used, patients recovered or are recovering well. So I think when the dust settles on this, there will be some optimism about the value of such therapy.
Okay, and I also want to get into the fear factor. When it comes to Ebola, there's a lot of hype around it, and a lot of people are concerned because it's a mysterious virus. You mentioned two aspects of fear and how that really can kind of balance each other out.
Right. It's mysterious. There's this unknown factor. There's uncertainty. And when those come together, we get anxious and concerned. I would not discount the fear. I think the fear is valid. It needs to be better reasoned through. And if we look at the science of fear, how fear is developed, there are two factors that play into this. Your perception of severity, how severe you perceive Ebola to be, and your perception of risk of contracting it. It's the product of those two factors that result in fear and anxiety. In this instance, how severe is it? It's very severe. It's deadly. But on the other hand, it's hard to catch. So if we are well reasoned in our thinking, we should say, or come to recognize that your risk of catching this severe virus is almost zero, if not zero. So if it's well reasoned, one should leave not feeling threatened about this.
Okay, sounds good. Now we also mentioned treatment when it comes to the supportive therapy as well. Just being able to support someone's immune system while they're going through this and while their body is trying to build up these antibodies. What's the best form of treatment that seems to be out there right now when it comes to Ebola, even, you know, whether it be in the U.S. or whether it be in West Africa?
Right. Well, we've been hearing a lot about experimental therapies, and we do not know conclusively what the contribution of those is. But we do know what works. We do know that early diagnosis, isolation, and basic supportive therapy significantly increases your chances of recovery. And when I say supportive therapy, I mean maintaining a patient's vital functions, blood pressure, nutrition, electrolytes, you know, being comfortable, addressing pain, etc. And those are well-established medications and procedures for addressing those. But even such basic care is not available in places like West Africa. We have that here. We have an abundance of care in the United States. And in addition, all of our patients here had some form of experimental therapy, either the serum, ZMapp, some other experimental therapy. So treatment in the U.S. is resource intensive. You will never be able to replicate that in West Africa. But what we are seeing is that when it's given, you significantly increase your chances of recovery, and you recover.
Is there anything that I have not brought up that you think is very important to mention, or maybe that you've heard out there?
Well, when we talk about concern, I would say that if there is to be concern, the concern should center on West Africa, because this epidemic is rapidly expanding exponentially. And as it expands in West Africa, the chances of cases coming to other countries, as we have seen already, escalates. So we've got to continue to focus our efforts on resources on helping to stem this epidemic in West Africa.
What would you say is the best way to do that?
I will go back to the three old factors, the factors that we know work. We need rapid diagnostic testing. So far, the test takes 4 to 6 hours to return a result. In that time, people are housed together, people with Ebola and other conditions. And if someone has Ebola while you're awaiting that results, imagine the spread if they already have the symptoms. So we need early diagnosis by way of rapid testing. So we need to focus efforts on developing technology in that area. We need to continue to build centers so that we can isolate these patients once the diagnosis is made, and ramp up resources so that we can provide effective supportive therapy.
Okay, thank you. Great job.
Thank you.
I can't wait to do it.